Welcome back to Carolina Journal Radio. I'm Donna Martinez. Over the past decade, we've had a big debate in this country over how to expand access to affordable health insurance and affordable health care. But despite passage of the Affordable Care Act, Obamacare, affordability of insurance and care remains elusive to some, particularly those who have high deductibles and high copays with their insurance policies. That can lead to medical bills that some folks simply cannot pay. Our next guest is working with a private effort to help wipe away old medical debt that's dogging some low-income North Carolinians. Jordan Roberts is the healthcare policy analyst for the Locke Foundation. He joins us now to talk about this. Jordan, welcome back.
Thanks for having me.
I thought Obamacare was going to make insurance and care affordable.
Yeah.
It hasn't.
That's right. So, we hear all the times about people struggling to afford insurance, and then a lot of times, even when they have insurance, it doesn't work for them in that, you pay a premium and you expect some of all of your medical care to be covered, but then you go to the hospital, go to the emergency room, and you wind up with a huge surprise bill or a balance bill from, a doctor that wasn't in network, and then the insurance company says you're on the hook for that. So, while we have trouble with affordability, we also have trouble with insurance not working the way it's supposed to for folks.
Tell us about a balance bill and a surprise bill. You mentioned both of those. What are they?
So this is some of the most pervasive issues with insurance is that when you go to the hospital and get a procedure done, your insurance company and the hospital negotiate to pay what they think is a fair rate. And sometimes if it's the hospital charges more than what the insurer is willing to pay, the hospital will balance bill a patient and send them the remainder of the bill. So that's one example. If there's just a disagreement between an insurer and a provider and the patient really has no say in that. And then the other example is a surprise bill is when, let's say you go and get a procedure done and the hospital's in network, your surgeon's in network, but then the anesthesiologist is out of network, and so you think you're all covered, you've paid your co-insurance and your deductible, then all of a sudden you get a surprise bill from an anesthesiologist who's not in network, and that could be double, triple what the procedure cost you in the first place. And once again, being out of network, your insurance is not going to cover that. So this happens all the time, many different examples and different ways that it can happen. But, the main point is that the patient really has no recourse or any way to, negotiate this bill or anything, and oftentimes they're stuck paying it.
So no matter how or why it comes, you're going to get a statement in the mail that says that you owe, and it could be thousands of dollars.
Absolutely.
Now, as you said, you can't challenge this. You just have to look at it and say, okay, how do I pay this? And
Right.
The reality is that some people, particularly those who are of modest income levels, living paycheck to paycheck, simply cannot pay the bills. So the bill ends up going to collection?
Right. So that's what happens. Sometimes these hospitals will, try to go and collect these wages or collect these bills in different number of ways. We heard there's a big story out of South Carolina that they were using the local revenue departments to garnish tax returns to get these bills back. Sometimes they even just sue patients and take them to court. There's a lot of different ways that they can go about it. But, once again, the patient just really either doesn't know or has no means to pay that when they weren't suspecting the bill in the first place.
So this then becomes an issue for their credit report as they try to go ahead and pay their other bills,
Right.
knowing that this big bill is looming. It's gone to collection. The hospital is trying to get the money. Then the hospital can also sell off that debt to
Right.
private collection firms.
Yeah, and so that happens too, and then, it's off the hospital's books, which is their eventual goal to get paid anything, so they'll take whatever. And now the debt is over to a collection agency, which has become a pretty big industry now because of so many outstanding medical bills with our convoluted healthcare system. So this is a pretty persistent industry here that will buy debt and then own the debt, and then they use different means to try to collect it too, just like the hospital.
This is where it gets really interesting. And Jordan, you are involved in a project, and this is a private project. Mm-hmm. It's outside of the Locke Foundation,
Right.
where you are a policy analyst, but you've gotten involved in an effort to try to actually help these people who are now being dogged by this old medical debt. It's hurting their credit report, and it's something just looming in their lives. Tell us about RIP medical debt.
Yeah, so I'm really excited for a service project I'm doing. I'm partnering with RIP Medical Debt to wipe out as much old medical debt as we can for individuals in North and South Carolina. And so the individuals for the debt, in order to qualify for the program, the individual has to be making less than 2 times the federal poverty line. They have to owe more than 5% of their annual income, and the debts have to be greater than their total assets. So we're talking about the lowest income individuals that really have no means to pay these off. And the great thing about RIP medical debt is it was started by 2 old collection agency executives. And so what they now do is they sponsor campaigns like mine to raise money. I will give them the money, and they will purchase portfolios of old debt off the secondary debt market, where like we were talking about before, that these collection agencies have bought, and they will wipe it completely clean and no effect on their credit. So it's really great. And the best part about partnering with RIP Medical Debt is the collection agency expertise allows them to purchase the debt for pennies on the dollar. So roughly it comes out to every dollar that I can raise will wipe out about $100 of old medical debt.
Jordan, this is really amazing because you're talking about something here where government's not involved. This is a private effort. It's you as an individual reaching out to literally impact and change the lives of unknown numbers of North Carolinians and South Carolinians as well involved in your effort. That's amazing.
Yeah, I'm really excited about it, and I hope what we can do here is raise as much money as possible, raise the awareness of this issue that a lot of times these people come to this debt through no fault of their own. And this is not to say that you shouldn't pay your bills and should collect up debt or you should rack up debt that other people are going to pay off. This is really people that fall victim to the problems of our healthcare system through no fault of their own. Just trying to access care, and then all of a sudden they're hamstrung by some multi-$1,000 bill that lingers forever. So those are the people we're trying to help out that become victim and really have no other means to get out of the red.
Jordan, I have to applaud you because this really does fit into the mission of free enterprise and personal responsibility, individuals reaching out to help other people, and again, no government involved. Right. And this is really what it's all about.
Yeah, thank you.
Now, if people are interested in finding out more about Jordan's effort and RIP medical debt, just send an email over to Jordan. Jordan, you want to give out your email address?
Yeah, so my email is jroberts@johnlocke.org, and I also have a link for the fundraiser page. If you go to bit.ly/Jordan Roberts, my name, you will find my RIP Medical Debt fundraising page. You can donate money there too. Also there's a link to buy tickets to an event, a fundraising event that I'm holding in February. All ticket proceeds will go towards the fundraiser. So we hope that everyone can join us for a night of food and drinks, raising awareness about this issue that's plaguing our neighbors.
And Jordan, Jordan is a healthcare policy analyst here at the John Locke Foundation. So he is really attacking this issue from both sides, so to speak. You are doing a lot of analysis and writing about ways that North Carolina and the country can actually take policy steps to expand access to care and make things more affordable. So all of that is available, Jordan's writing and analysis at johnlocke.org. And then from the other side, once people are caught in this trap, you're trying to help too. So it's just a tremendous effort. Jordan Roberts is healthcare policy analyst for the John Locke Foundation. Thank you very much, Jordan.
Thanks, Donna.